is Emily Iannielli, and I'm a male to female transgender girl, and I'm all excited about some recent developments in my life. I'm actually in contact, I was on the phone all day today with Dr. Marci Bowers' office. I was speaking to a lovely young lady, Safina, and actually in the process of doing the application forms for the gender reassignment surgery. I've been wanting to do this since I was a 16-year-old transgender girl teenager. So this is like a lifelong dream for me. And Dr. Marci Bowers is one of the best of the best. She's the top surgeon in the field of gender reassignment surgery, and she's a well-known and well-established gynecologist and surgeon. So I would be overjoyed if Dr. Marci Bowers does my gender reassignment surgery. I'm working with the health insurance that I have, and Safina informed me that they opened the case with my health insurance carrier, so that's exciting news. And I have my application form for Dr. Marci Bowers that I completed, and I'm all excited. It's a two-page application form and then a one-page authorization form for the medical surgery. So I'm all set to send this tomorrow to their office, and excited. It's been a long journey for me. I started transitioning about 2.5 years ago. I started going to a therapist, and I was in the hospital actually for severe depression, and I think it really stemmed from my gender dysphoria, and I had an emotional breakdown because I lost my job, and the stay in the hospital was very helpful for me, and they put me in touch with Beth Israel for aftercare, which was when I met my therapist and psychiatrist, and they are very supportive of my transitioning, and I'm very happy to have them both as medical professionals to help me. And I also go to Callan Lord. My doctor at Callan Lord is Dr. Juliet Woodruff MD, and she's the one who I met to start on the female hormones, estradiol and testosterone blocker, spironolactone. When I first went, she wasn't going to start me on the hormones yet. She needed to make sure that I was ready for it, so I had to go several times, and within 3 months she read me the Riot Act about the dangers of doing hormone replacement, potential dangers of doing hormone replacement therapy. And I was well aware, but I was eagerly, and she laughed that I signed it so eagerly. But this is the lifelong struggle, and I know that if I'm going to transition, I need to start on hormones. So that was a non-issue. I knew right away, as soon as she gave me the go-ahead, I knew I was going to go for it. So that was the beginning of my transition, and then I was continuing with my therapy. I go to Dr. Stephen Schneider at Beth Israel, who I love, and Dr. Amy Swift. Dr. Schneider's a PhD. He's my therapist. And Dr. Amy Swift is a MD, and she's my psychiatrist. And I need to get my letters in order, so I'm going to reach out to them. I also reached out to Dr. Juliet Woodruff, and she already has my letter waiting for me. So, you know, I'm all excited. I've been struggling with my gender issues since I was a 3-year-old. I knew at that time I was different. I felt like a girl. It was very painful for me, and I didn't know how to deal with it. But I started wearing dresses at that young of an age. I stole one of my sister's dresses that was a little too big for her, and that was mine. I took it, and I slept in that dress at night under my covers, and it made me happy. I felt comfortable, and I felt like the girl that I always knew I was. So I knew I was a girl at a very young age, and that's typical for transgender people. They typically know at a very young age. I struggled with my gender all my life. When I was a teenager, it was a nightmare. I wanted so desperately to be a girl and develop like a girl, and it was a painful time. And I even attempted suicide when I was 16. So it was hard, and I couldn't tell anybody. I really was an emotional mess. I just hated my body. I hated being a boy. I wanted desperately to be a girl. I wanted to wear dresses. I wanted to live as a girl, wear pretty shoes, and I just cried. You know, it was hard for me. And I learned at 16 about transsexuals. I didn't know about the term transgender at that time, but I learned about transsexualism, and I learned about Dr. Harry Benjamin and the standards of care, and I learned about a famous tennis player, Dr. Renee Richards, who was a well-known established tennis player as well as a medical doctor, and she transitioned from male to female and had the cyst surgery. And I read about her, and I read about some other people, and I knew then and there that's what I was, a transsexual. But I didn't know what to do about it. I couldn't tell my parents. I couldn't tell anybody, basically. I kept it to myself. And the only way I dealt with my gender struggles was cross-dressing. It gave me an outlet and a way of expressing my true gender feelings. I felt very comfortable when I dressed in girls' clothes. It felt perfectly normal for me to be in girls' clothes. And, you know, I tried to appreciate those times because they weren't many, they were few and far between. But anytime I had the chance to dress up, I just relished it. It was my time, and it was very enjoyable, and it was just me with my clothes and my way of self-expression. And I was me, I was Emily. At that time I didn't really have a name selected. I just dressed up and felt happy, and I cried a lot. It was a very difficult time for me. I didn't know how to deal with my feelings. I tried to live as normal life I could. You know, I did good in school, and I was very obedient as a child. I listened to my parents, and I loved them very much, and I never felt that I could tell them, unfortunately. So I never really shared my true feelings with them, and I feel sad about that. But my parents had their own struggles, so I didn't want to burden them with mine. So I just tried to deal with my feelings on my own terms. And I got depressed. I basically lived with depression all my life, which is associated with my gender dysphoria. And I've defined gender dysphoria in my previous videos on YouTube. All gender dysphoria really means is that your mind and how you perceive yourself from a gender perspective is different from the assigned sex that you're born. So I was born as a male, but in my mind and my heart and my very existence, my soul, I identify as a female. So even though I was born male, I am very much a female. The way I feel about myself, the way I express myself, I'm very feminine. I've always been that way, but I couldn't express it to anybody. And I knew one day I would have to face that. You know, I tried to live a normal life. I tried to do the right things. You know, I knew college was important. I knew education was important. You know, I knew family was important. Sports was very important to me also. And I just wanted to be normal. You know, I wanted to try to fit in and be accepted. I was a very shy kid and pretty much a loner and very isolated. I didn't fit with others. I couldn't associate with the girls, and I couldn't associate with the guys either. It was just, I was basically a loner, and it wasn't until high school that I really got involved in sports. You know, I was in Little League Baseball when I was younger, and that was a good thing. I met kids my age, and I had some friends, not too many, and I was pretty good at playing baseball, and I loved the game. And then when I went into high school, I wanted to play on the baseball team, but I got cut, and luckily a coach, who I didn't know at the time, he is a math teacher also, recruited me on the cafeteria line and changed my life and got me involved in running. I ran cross country, and that was very helpful for me, and it took me out of my shell and gave me a sense of purpose. So not only did I have the school achievements, but I also had my running achievements to strive for. And I had a good coach. He was a good mentor, and he took me under his wing. I didn't make varsity. I was on the JV team, but to me, I was just happy to be involved in a sport, and I, you know, did my best. You know, I wasn't a tremendous runner, but I held my own, and I finished all my races, so that was a very positive thing. I was cross-dressing all my life, though, and the running kind of helped me to not get too caught up with that. It was another escape for me, whereas the cross-dressing was one escape for me in dealing with my gender struggles. The running was an escape to kind of get away from my gender struggles and try to escape the cross-dressing for as much or as long as I could. And it was healthy. It was a healthy outlet for me. And I enjoyed it. And I was in good shape. I was probably in the best shape back then. And I had a very good disciplinarian for my coach. And I enjoyed it. And I made friends. I ran and I was accepted as a teammate. I had wonderful friends from the cross-country and the track teams. And I'm even in touch with, one member from my team I am in touch with, and I respect him very much, and I love him. I think he's great. His name, and I don't think he'll mind if I mention it, is Teddy Canova. I think Teddy's a great guy. He's very understanding of my situation, being transgender, and he's been supportive, and he's just a wonderful person. And we both have one child. Teddy's a great guy, and I always loved Teddy. When I was on the track team and the cross country, he always was there for me. He encouraged me. So it's nice to have him still in my life as a friend on Facebook. And he even reached out to me on the telephone a few times. So, and I met with Teddy. Last time I saw him was at Coach's 75th birthday party. So Teddy's a great guy, and he's very understanding, and I'm grateful for that. And you know, it's nice to have good people like Teddy in my life who understand and accept me for who I am. You know, I'm just me, you know, I'm not any different from anybody else. All I ever wanted in my life was to be happy, and I'm very lucky. I'm married, I have a beautiful wife in my life. She struggles with my gender issues, and she quietly accepts my situation. You know, she knows that I'm not doing this on a lark. She knows that it's been something I had to deal with since a young kid, but I never told her until later. I was afraid when I was dating her, so I never came in conversation. And we have a beautiful son. My son is my life. I love him very much. And he has his own struggles. He's autistic. But I try to be there for him. And I always tell him, no matter what, if I'm transitioning to become a woman, I'll always be his dad. And I want him to call me dad, because that's who I am. And it should always be that way. But I'm becoming true to who I am as a person. I'm living the way I should, the way I've always felt. And it's taken me quite a long time, but I'm happy, and I hope that people will come to understand transgender people and realize that they're not crazy, that they're good people, and really all they want is to be happy. That's all I want. I just want to be happy and to be accepted and loved for who I truly am. And, you know, I don't ask for much more than that. And for me, surgery is very important because it's part of the transition process. And for me to feel truly female, the surgery will be the crowning glory to the full transitional process. That would be the cherry on the whipped cream of the sundae. It would be the icing on the cake. It would just be the top, you know, and who better to perform my gender reassignment surgery than Dr. Marci Bowers. Her reputation is impeccable. She's one of the most premier surgeons in her field. She was trained under Dr. Stanley Weiber, who actually performed her surgery. She's also a transgender woman, transsexual woman, and she's beautiful and she's very intelligent. She went to medical school. She's a surgeon, a gynecologist. She's an amazing woman, and I look up to her. She's my role model. And if anybody's going to do my gender reassignment surgery, I want Dr. Marci Bowers to do it. I was happy today. I was on the phone with Safina at Dr. Marci Bowers' office, and she gave me the good news that she was on the phone with my health insurance company, and they opened the case. So that was a good thing. The only thing was I had to redo my application forms, because when I first did them, I did electronic signature and electronic initials, not realizing that they had to be by hand. So it was not a problem. They just resent me the paperwork, and resubmitting it tomorrow by fax. And I'm all excited, and you know, this is a lifelong dream for me. You know, I never thought it would ever be possible, but you know, this is something I've been wanting since I was a 16-year-old kid. I wanted to transition way back then, and just felt all alone. You know, I never started therapy until I was in my early 30s, several years after my mother passed away. And I loved my mom. She was a very sweet woman. And I then subsequently, through going to therapy, eventually met my wife. Because my therapist introduced me, she kind of discouraged me from transitioning back then. So I did get married, and I have a son who I love. And then when I lost my dad, sadly, a few years ago, and then a close friend a couple years later, I had to go back into therapy, and then I kind of realized my own struggles and started talking about being a lifelong transgender girl, and I kind of realized what I've always known in my heart was that I needed to start the process to transition. And it was very hard for me to tell my family, certainly my wife and then my son. I had to be very delicate in how to handle telling them. And then telling my sisters, and then close friends, and obviously my employer. And that didn't go well. I eventually lost my job. So, you know, these are issues that most transgender people have to face. It's not a perfect world, and a lot of people don't understand where we're coming from. For me, I understand perfectly clear because I know what it's like to be transgender. And I don't think of it as being crazy. I think of it as being just who you truly are. And it's better to be truthful than to live in pain and suffering and wanting to kill yourself all the time. That's not good. So I came to realize when I felt I'd rather be dead if I don't transition, that was my breaking point. And I said, geez, I don't really want to die. I just want to be happy. And I want to live to be a woman like I always felt inside. And that's when I knew I had to transition. And then I got in touch with Callan Lord through crossdressers.com. I was trying to find a place to go, and I saw someone relaying their experiences in the thread, highly recommending Callan Lord. So that's how I got in the idea to get in touch with them, and I met Dr. Juliet Widoff, who's really helped me tremendously, and got me started on the hormones and the testosterone blocker, and I'm just very happy now, and I am keeping my fingers crossed that the surgery will happen for me. I'm on a waiting list, and I gotta get the letters to Dr. Marci Bowers' office along with the application form, because I really want to get this process going. I'm very serious about it. I want to have the vaginoplasty, which is gender reassignment surgery. Basically what they do is they invert the male anatomical part to create a vagina. So they would invert the penis and create a vaginal canal, and the vagina would be fully functional. I wouldn't have anything like women do, like a uterus, ovaries, fallopian tube. Those things are not medically possible at this time, and the costs would be astronomical. But I'll just be happy with a vagina. That would be a dream come true for me. And I have small breast development, so I'm not going to do any surgery for my breasts. I just hope that the hormones will help in increasing my breast size. Right now I'm wearing a 34A bra, so I don't have a big chest. I would love to have a 34B at least. And but I'm just happy being me and wearing women's clothes and dressing and living 24/7 as a woman. I do meet all the criteria that is necessary. I am on female hormones now more than 2 years with the testosterone blocker. I started living 24/7 as a woman, the real life test they call it, for more than 2 years. I've been in therapy for over 2 years. The only thing, and I'm filled out the application, and I'm working with my health insurance through the doctor's office, and I'm getting the letters in order. So once all that's done, then it's just waiting, and I'll be placed on a waiting list. And from what I understand, Dr. Marci Bowers' waiting list is out to almost 2 years now. So, I have quite a wait, and I would love to have the surgery done within a year, but as long as it's going to happen, that's really my wish, and I hope that it will. I really want to be a female. I've always known I was a female, and I think it would be wonderful. I still will have my loving relationship with my son, and I'll still be there for my wife, and do everything I can to keep the house. And I'm on medical disability right now. I'm not working. Maybe I can try to build my accounting practice on my own, hopefully, and live and be a woman in the process, which I am anyway. I live 24/7 with the exception of having a job. And if I worked, I would certainly present as a woman anyway, so that's a non-issue. And I'm working on my voice to establish a more feminine voice. And I just want to be me. I want to be Emily. I want to be happy and just do the best I can. And if there are any transgender girls out there, I have met so many wonderful girls on Facebook. One girl in particular, Manha, I love her. She's from Sri Lanka, and she's and I are very close. We live quite a distance away, but we always communicate on Facebook, and I've even called her on the phone. So, and I have a lot of good friends. I also go to support groups,